Good morning, friends. Welcome to our next learning session. And today I am going to talk about a disease called pulmonary edema. Pulmonary means lungs, and edema means collection of fluid. When fluid collects in the lungs, we call it pulmonary edema. What are the lungs? We must understand what are the lungs and what their function. The lungs are organs of respiration. See, lungs are organs of respiration. Am I able to show you? Lungs are organs of respiration. Lungs are organs of respiration. In these organs of respiration, the air from the atmosphere enters containing oxygen, and this oxygen diffuses through the small sacs called alveoli into the blood, and carbon dioxide from the blood diffuses across the capillary membrane into the alveoli, from where it is sent out of the body. So this is basic respiration. You must know that oxygen is taken in and carbon dioxide is thrown out. From where does carbon dioxide come? You should know it that when glucose is burnt, when amino acids are burnt, when fatty acids are burnt in the body to create energy for the functioning of the body, they require oxygen, and this oxygen when combines with the amino acids produces carbon dioxide as well as some energy which is stored in the body in the form of chemical compound called ATP. Well, anyway, we are not going into detail of this ATP, but here the important thing is that from the nose to the windpipe, from the windpipe to small branches, from small branches to very small branches, and ultimately to small sacs called alveoli. These are small air sacs. These are called alveoli. Their wall is so thin that between blood and the air, there is just thin membrane through which oxygen and carbon dioxide can easily cross. So oxygen from the alveoli diffuses into the blood, and carbon dioxide from the blood diffuses into the alveoli and then thrown out of the body. If these alveoli contain fluid, then this function cannot be carried out of diffusion of oxygen into the body and diffusion of carbon dioxide back into the alveoli. Now see, I have tried to show it here, that pulmonary edema, you can keep it here and make a note out of it, of the pulmonary edema. In short, I have told you already what is pulmonary edema. It is the collection of fluid in the air sacs. In most cases, what is the cause of this pulmonary edema? The cause is some sort of cardiac disease like myocardial infarction or severe acute left heart failure, left ventricular failure, where for example, a person is having hypertension for a long time, and his body has already exhausted compensatory mechanism, and then suddenly blood pressure rises and the patient goes into heart failure, or the patient has got some cardiomyopathy or some other, and sometimes some toxic gases can also cause it, but here we are concerned with only the cardiogenic pulmonary edema, that is induced by the disease of the heart, that most commonly is the myocardial infarction, that is the heart attack. Now see in this diagram, what do you see? I will show you. This is the one diagram. You should look at it to understand. This is the normal alveoli. You can see normal alveoli. You see there is no nothing in the blood in the alveoli, but see this, there is a bluish fluid you can see in this. This is a bluish this is marked to show you that this is the fluid in the alveoli. Here it is not there comparison. So this is pulmonary edema, this is normal lung, this is pulmonary edema. See another diagram further to illustrate the same thing. See, this is normal lung, and see this is normal alveoli, and this is the alveoli filled with fluid. See, this is bluish. This is all fluid in the alveoli. This you can call it water in the sacs, and therefore the oxygen which was coming like this, oxygen was coming like this, going right side, going left side, going to both sides, this way, then small branches, further small branches, and then ultimately reaches these alveoli. So these are normal, these are empty alveoli. Air which is coming from here can easily, oxygen can easily diffuse into the blood, and carbon dioxide can diffuse back into the alveoli. But here, because fluid is there, this thing cannot be done. Oxygen cannot go into the blood and carbon dioxide cannot come out. Therefore, the patient feels difficulty in respiration, and due to these this fluid in the alveoli, when the air passes through this produces bubbling noises, which I said bubbling crepitations. Now see another diagram. This is normal, and this is pulmonary edema. You see, this is the pulmonary edema fluid which has come up in the pulmonary alveoli. See another diagram which I want to show you is the X-ray chest, how it shows you the pulmonary edema. See this X-ray chest. This is the pulmonary edema. This is a picture of pulmonary edema. This is all because of so much fluid in lungs that it is all hazy. It is all hazy because of the fluid in this thing. So friends, about more than 40 years back, when a doctor who was in charge of MCD hospital called me to see his mother. His mother was a known case of hypertension. She was in late 60s and she was having difficulty in breathing. I examined her and found coarse bubbling crepitations in both lungs, widespread, which I could easily make out that she has gone into pulmonary edema, probably secondary to myocardial infarction. So instead of wasting time for further investigations at home, I suggested the doctor that let us shift her to the hospital. Meanwhile, I started the oxygen inhalation and gave 60 milligram of Lasix, that is furosemide, intravenously to the patient. This is a very quick acting diuretic. It removes fluid through the kidney out of the body, but sometimes there is a loss of some electrolytes, particularly potassium, and due to hypopotassiemia there can be some complications. So but at such emergency levels, you do not worry about the side effects, you worry about to treat the basic condition of the patient. So I did that, and patient developed acute gastric dilatation while we were transporting the patient to the hospital in the ambulance. The ambulance was totally ill-equipped. The tube going from the oxygen cylinder to the patient was sealed at least 6 places with sticking plaster. So I was wondering how much oxygen is going to the patient. But anyhow, by the time we reached the hospital, the patient was cynosed and was declared broad dead. In another case, an aged Sardaji developed myocardial infarction. I was asked to come to patient's residence and see the patient. I examined him. The blood pressure was not recordable. The hands and feet were ice cold, and I told them that this is a patient with myocardial infarction with cardiogenic shock, and the chances of survival are nil. You better shift the patient to the hospital. But for their own reasons, they said that we do not want to go to the hospital. You treat him at home. I said there is hardly any treatment, but since they insisted and they were through some acquaintance, I agreed to do it. I called an anesthetist also to give me assistance. We started glucose saline, and the patient's blood pressure started coming up. When we were feeling satisfied that the patient is responding, patient developed pulmonary edema. The same course bubbling crepitations as I described in the previous patient, this patient also developed, and we lost the patient. See why he developed pulmonary edema when the blood pressure was coming up? Because the time it took when after myocardial infarction, the blood pressure fell to practically not recordable levels. That caused damage to the kidney, and when the kidney did not function, heart was already compromised because of myocardial infarction. The fluid given raised blood pressure, but it also went to the lungs and accumulated there, causing pulmonary edema. So pulmonary edema is a condition in which the fluid, or you may say water, accumulates in the air sacs. The function of air sacs is to pass oxygen brought from by your respiration into the blood and diffuse carbon dioxide from the blood into the alveoli and then out of the body. That is the basic function of the alveoli. They have a very thin wall between the oxygen and carbon dioxide and the blood. Between the blood and the cavity of the alveoli, there is a very thin wall through which easily oxygen and carbon dioxide can diffuse. Since concentration of oxygen is more in the alveolar sac, therefore it diffuses into the lungs. It will always go from the higher level to the lower level. And since carbon dioxide is more in the blood than in the alveoli, therefore carbon dioxide moves towards alveoli. We use the word diffuses because there is a membrane. It cannot move. It diffuses through the membrane into this thing. So friends, this is what we must keep in mind while treating patient, that pulmonary edema is another very severe condition. As I told you before also, that myocardial infarction has many complications. Some complications can easily kill the patient, and one of these complications I said was the ventricular premature beats going to ventricular tachycardia, fibrillation and death. And the other complications are cardiogenic shock, in which 99% patients die, and pulmonary edema, in which more than 50 to 55% patients die who develop pulmonary edema after myocardial infarctions. There can be other complications like left heart failure, mild and then moderate degree before it becomes the severe degree. So I will not talk of other complications of myocardial infarction. I will keep it on a separate day when I will discuss all the complications of myocardial infarction. So friends, thank you very much. You continue your support in the form of subscribing the channel as well as commenting on the videos. Thank you very much. We will meet next time with another case.